Hospitalizations, of course, a key metric that we're always watching. In Ontario yesterday, climbing past the 1,000 mark for the first time since February. And while mask mandates were lifted by the province last month, Toronto's medical officer of health is now urging people put them back on while in public spaces. And in fact, you tweeted yesterday, quote, "Masks work better than fourth doses, just saying." What's your message?
Yeah, I mean, I haven't taken my mask off. I know many people haven't. It's just such an easy thing to do. You know, it's not trampling on anyone's rights to say, put this thing on your face. It'll help reduce your transmission if you happen to have the virus unknowingly in many cases. It'll also help prevent you from catching it from others around you. It's something that's been shown to be highly effective. And particularly in congregate settings, particularly in high-risk settings, like schools being an example, just such an easy thing to do at a time where we know there's so much virus in our communities. Consider it a courtesy, something that I think all of us can do for our neighbors, for people around us.
Okay, well, let me ask you this. Many Canadians have contracted COVID-19 just in the last few months or since the beginning of the pandemic. And so then they've also had 3 shots, let's say. So they're almost considering that as if they've had 4 and they're feeling pretty immune. But what is your message as to whether they should continue to wear a mask while indoors?
Yeah, so a couple of points there. If you've had infection earlier in the pandemic before Omicron, the forward protection against Omicron is not great in terms of natural immunity. On the other hand, if you had an Omicron infection, we think if you had infection with BA1, the initial strain that we saw, your protection from BA2 and another BA1 infection is probably very good. So I would think of that practically, at least in the short term, as if you got a 4th dose, as if you're boosted. The problem is that the viruses that we currently have just aren't all that effective at preventing infection from Omicron. They're still very good at preventing severe disease, but they're just not all that effective at preventing infection. So even if you've had that infection with Omicron, plus your 3 doses, and you're thinking of yourself as somebody who's kind of boosted, double boosted, who has as if they have 4th doses, you still need to keep that mask on to protect people around you and protect yourself, because mild infections can still happen, and mild infections is how we continue to spread this virus forward.
Doctor, it's always great to get your insights. Appreciate them this morning. Thank you.
Pleasure. Take care.
Dr. Gupta joining us live.